Good morning and a very warm welcome to CRAN's Pan-Tumour Early Age Onset Cancer Symposium. We are absolutely delighted to have you join us for this event, which we sincerely hope you will find to be engaging and informative. My name is Cassandra McCauley, and I will be guiding you through this symposium for the next 2 days. Through my role as Chief Research Officer at CRAN, I have the absolute privilege of amplifying patient voices and making just a small contribution to improving cancer care on behalf of Canadian cancer patients, and it is an honor to facilitate this important event. Our remarkable team has worked incredibly hard to bring this symposium to fruition, and this year's theme is focused on advancing sustainable and personalized care for early age onset cancer patients. We are talking about addressing systemic barriers to improve outcomes. We've brought together experts and thought leaders across oncology, research, primary care, policy, and more to spend the next 2 days looking at how we can improve care and outcomes for younger Canadians impacted by cancer. Each one of our panel discussions includes a patient panelist to ensure that our conversations remain rooted in patient perspectives and values. The theme for the first day of our symposium is From Gaps to Action. We're talking about transforming early age onset cancer care, detection, and diagnosis through policy and innovation. So I invite you to settle in, get comfortable, and learn alongside me as we hear from some remarkable experts throughout this event. I'd like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I acknowledge the importance of these lands, which we each call home, and where we live, work, and play. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Further, this recognition and respect for Indigenous peoples and their lands is a key step towards reconciliation. Please take a moment of reflection to acknowledge how we can each, in our own way, try and move forward in a spirit of reconciliation and collaboration. On a personal note, I'll share that I attended an Indigenous learning workshop in my community earlier this year, and I try and take the time to reflect upon those teachings when I'm outside hiking and enjoying nature. So we have a diverse audience joining us throughout the symposium. So before we get started today, I'd really like to take the opportunity to talk about what early age onset cancer is. When we speak about early age onset cancer, and within the context of the symposium and more broadly in the literature, we're referring to any type of cancer that was diagnosed between the ages of 18 to 49. There is a slight distinction in terminology between early age onset cancer and the AYA cancer population, the latter of which typically refers to individuals impacted by cancer in their adolescence or their earlier years of young adulthood, extending generally to the age of 39. Unfortunately, incidence and prevalence of cancer is rising in the population under 50 across many tumor types. This is a global phenomenon. Gastrointestinal cancers, and in particular colorectal cancer, are leading this rise, though many cancer types are impacted, including breast, endometrial, and prostate cancers and others. The why is a big question, and we have dedicated quite a bit of discussion to this throughout past events within the Symposia series. Scientists don't have one answer, and it is almost certainly multifactorial, but environmental factors such as pollution and chemical exposure, lifestyle factors such as the Western diet and sedentary behaviors, these things increase risk. There is emerging evidence and ongoing discussion about the importance of the gut microbiome in cancer risk as well. It's critical to note that these are risk factors, not specific causes of cancer. Most cancers occur as a result of a sporadic, so a random mutation, which may be influenced by risk factors. However, individuals can lead very healthy, low-risk lifestyles and still get cancer. For the individual patient, there is certainly not one thing that was done wrong to cause the cancer, and it's important that we move away from any blame, shame, or stigma associated with an early age onset cancer diagnosis. We know that the tumor biology itself is often different than the biology in the older population, and unfortunately, this often results in more aggressive disease characteristics. Early age onset cancers are more likely to be diagnosed at a later stage, often in the metastatic setting. And this is attributed not only to the more aggressive tumor biology, but also the broad dismissal of symptoms and the sentiment of being too young for cancer. And finally, experiencing cancer at a younger age comes with a very unique set of needs and challenges, from social considerations and isolation, dating, intimacy, and fertility, school or work disruptions, financial instability, incredibly difficult family and parenting challenges, and so much more. And these needs tend to be poorly addressed through traditional models of care, which quite frankly are designed for older cancer populations. These unmet needs are what inspires and informs CRAN's work in this space. So now that we're all familiar with early age onset cancer, I'll take a moment to introduce ourselves. So the Colorectal Cancer Resource and Action Network, or CRAN, really originated as a grassroots colorectal cancer information and support group. Today, CRAN has proudly become a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors and counseled by a wonderful expert medical and scientific advisory board. At CRAN, we have 2 patient advisory councils, one of which is dedicated to the under 50 population, and their perspectives and past experiences with the disease help to inform our program development to ensure that our services are relevant and meaningful to those whom we support. In terms of our mandate, we champion the health and well-being of Canadians touched by cancer and others at risk of developing the disease. And we do this by providing support, education, and advocacy to patients and their caregivers to help improve quality of life and longevity. CRAN has expanded our patient-focused mandate, and we do so to serve multiple tumor type patients with the ultimate goal of reducing the burden of cancer in Canada, as this is actually our mission. So to help ground kind of the impetus surrounding this symposium, I'll share a little bit about CRAN's mandate dedicated to early age onset cancer. So across tumor types, CRAN aims to promote best practices in early age onset cancer detection and diagnosis, while improving the treatment journey through access to advanced diagnostics and therapeutics, as well as models of care that are tailored to the unique needs of the early age onset patient community. As an organization, we are absolutely dedicated to raising awareness of the rising incidence and prevalence of early age onset cancers across multiple tumor types. And then specifically within the colorectal cancer space, we continue to advocate for lowering of the screening age to 45, a milestone that has already been adopted in the United States and remains a critical priority here in Canada. I'd like to take a moment to acknowledge the strength and the dedication of our 2025 Expert Steering Committee, whose guidance has been instrumental in shaping this year's agenda. We are fortunate to have Dr. Michael Rafel, medical oncologist and co-chair of CRAN's Medical Advisory Board, serve as the committee chair. Dr. Rafel has worked alongside clinical and policy experts, Dr. Mary Jane Esplin, Dr. Tanya Chawla, Dr. Stuart Peacock, Dr. Jason Karamchandani, and Dr. Shadi Ashamala to guide the development of this programming with our team here at CRAN. I would especially like to recognize our patient perspectives, Robbie Spring and Steve Slack. They bring forward the voice of the community and really help us to ensure that our programming is relevant and meaningful to patients as well as their care partners. This breadth of expertise within the steering committee has ensured that the symposium remains clinically rigorous, system-focused, and firmly grounded in what matters most to patients and families, and we are incredibly grateful for each member's expert contribution and participation. So as we host our 5th annual symposium this year, we reflect back upon CRAN's Symposia series, which has grown significantly over the years. We began by raising awareness and breaking down barriers, specifically in early age onset colorectal cancer. And by 2023, we expanded to a pan-tumour focus. Each year, the programming builds upon the outcomes of the previous events within the series, and each year the outcomes and the calls to action are captured within peer-reviewed publications. The evidence generated through these publications is utilized by CRAN and our partners to assist with advocacy efforts for improvements in early age onset cancer detection, diagnosis, and care. So day one of our symposium this year emphasizes system-level priorities and clinical innovation. And tomorrow we'll be shifting the lens to the lived experiences and challenges faced by younger patients. We'll kick off the symposium with opening remarks from CRAN's president and CEO, followed by a presentation highlighting key learnings from last year's event. Next, we're bringing you a panel discussion on lowering the screening age for colorectal cancer, followed by a session dedicated to increasing awareness and education in primary care, both of which are critical movements to ensure that fewer patients are diagnosed at an advanced stage. After lunch, we're back to talk about the system-level value of early detection and how improved access to advanced diagnostics can improve personalized cancer treatment in the metastatic setting. After that, we'll have a short break, followed by a new feature this year, a clinician roundtable spotlight on lung cancer advancements, and then a pan-tumour discussion on breakthroughs in immunotherapy. Some housekeeping notes as we get started today. So you can visit our symposium website at any time to see speaker bios and learn more about the programming as well as our partners. The agenda and patient resources that have been shared by our partnering patient organizations are available through the downloadable resources button below the video stream. And we also invite patients to visit our dedicated early age onset colorectal cancer hub. The symposium is being recorded and it will be available to all registrants post-event. All viewers are automatically muted. However, we do encourage your engagement throughout the sessions and welcome you to submit questions and comments by typing them into the questions bar below the video stream. Should you require technical assistance, please click the help button in the bottom right-hand corner of the screen. We also invite you to get social with us, so let's engage online as much as possible and keep these conversations going. If something is resonating with you, share your takeaway, your perspective on social media, and don't forget to tag us. You know, it takes a village, and Canada is truly home to some remarkable patient groups. And we are incredibly grateful to these partners who have supported this event through a speaking engagement, dissemination of our patient survey, or simply helping to spread the word about the symposium. Together, our collective voices are making an impact. Finally, we simply cannot bring events like this to fruition without the support of our sponsors. Merck, AstraZeneca, GSK, and Innovative Medicines Canada. Thank you for your support, which helps us to reduce the burden of early age onset cancers in Canada. And now it is my honor to introduce CRAN's founder, president, and CEO, Filomena Servideo Italiano, who will provide the president's welcome and highlight a compelling patient story. Filomena is a fierce yet compassionate advocate for cancer patients and their care partners across Canada. She has been actively involved in raising awareness of early age onset colorectal cancer for many years and has been a strong proponent of the need for specialized care to address the unique unmet needs of this subset of the population. Philomena truly keeps the patient perspective at the center of everything we do at CRAN as we provide patient-focused and evidence-based support, education, and advocacy for cancer patients across Canada. On behalf of our team, I can say that we are so privileged to learn from you and work alongside you to reduce the burden of cancer in Canada. With that, I'll hand it over to you, Philomena.
Thanks very much, Cassandra. That's very kind of you. Good morning, ladies and gentlemen, and welcome. Welcome to day one of CRAN's National Early Age Onset Cancer Symposium. We are truly, truly delighted to be hosting this pivotal event that aims to provide sustainable and personalized care information for early age onset cancer patients and their caregivers as we move the needle forward in addressing systemic barriers to help improve cancer patient outcomes. Over the past 5 years, we have borne witness to and documented the challenges and barriers to early detection and diagnosis of early age onset cancers, which includes diagnostic bias, where symptoms are often mistaken for non-cancerous conditions. There are diagnostic delays where patients may see multiple primary care physicians and specialists over the course of several months or even years before receiving an actual diagnosis. There's insufficient public and professional awareness and inadequate screening programs because most standard cancer screening programs are not designed for younger patient populations. And patient-related obstacles abound. There's a lack of health literacy due to a lack of awareness and education across the country, coupled with psychological hurdles, both of which serve as barriers to timely detection and diagnosis. And based on the outcomes of our previous symposia, there are care gaps that have been identified: limited access to diagnostics, lack of specialized care, aggressive cancer biology, and psychosocial impacts, namely young patients facing unique psychosocial challenges by way of disruptions to career and education, caring for young children and/or elderly parents, and the negative impacts on fertility, all of which contribute to what I refer to as this perfect storm developing across the trajectory of early age onset cancer care. To speak to a number of these issues, I am joined today by a remarkable human who has been living with metastatic colon cancer since January 2021, Miss Jessica Dassler. Jessica joins us today from Vancouver and is a staunch advocate for anyone diagnosed with the disease, but in particular, those under the age of 50, because she recognized early on the need for support, education, and advocacy in younger adults. Shortly after her 37th birthday, and a year after experiencing symptoms consistent with colorectal cancer, Jessica finally did receive a diagnosis of stage 4 colon cancer. Jessica has endured countless cycles of FOLFOX and FOLFIRI chemotherapy together with a targeted therapy Avastin, as well as more chemo pills. She underwent a colon removal and received a J-pouch because of an identified polyp syndrome and 2 cancerous tumors. Since then, she has undergone multiple lung surgeries, which has included participation in the in vivo lung perfusion trial during one of her open lung surgeries in Toronto. This required her to travel twice to Toronto and be away from her little girl for 10 days each time. This was then followed by spine surgery as a result of a disease-induced fracture to her back, and then a rib and lung resection that took place back in Toronto. She has received targeted radiation therapy by way of SBRT on her lung and bone tumors, as well as cryoablation on both a lung and a spine tumor. Today, Jessica continues to defy the odds and expectations. She has only 2 stable tumors remaining on her spine, which she is actively monitoring and for which she continues to seek a resolution. Ladies and gentlemen, it gives me great pleasure, and it is my absolute honor to introduce Jessica Dazzler, a member of CRAN and CRAN's My Lung Mets and My Advocacy Coach. Good morning, Jessica, and welcome.
Thank you for having me.
That's quite a journey you've been undergoing, my friend. It is
I
so inspiring, and I can tell you that you serve as such a beacon of hope for so many newly diagnosed cancer patients, regardless of tumor type. Look, you always bring such a tear to my eyes. Can we chat a little bit about that extraordinary journey of yours?
yes. I sometimes can't believe it myself what I've gone through in these almost 5 years. So,
I bet. Okay, can I ask you a couple of questions?
of
That's
course.
okay. Okay, all right. Number one, can you share with us what it was like to have received that diagnosis at such a young age, Jessica? And can you tell us, did your young age have anything to do with a delayed diagnosis that took well over a year to confirm?
Yes, it did. All the doctors that I went to, they kept on looking at me, and I did say someone said it's because of your age. You're too young for cancer. I even asked, "Is this cancer? You're too young." I was dismissed, and then it made it feel like they talked me out of actually investigating because it was very obvious that it was cancer, but they dismissed me. And that diagnosis was the worst day of my life. I was told by myself in my car, and I had to come out and try and explain this to my husband. And my daughter was 2.5 at the time, and I was given no hope and completely devastated. And I felt like I was basically dying at that moment. So, but things shifted from there. I could not live like that. So,
And I'm sure that it had an impact on your husband as well.
yes, he has to work full time. Otherwise, we would lose our house. He's been so supportive, but it's taken a huge toll on him as well. He's stepped up and has supported our family. But yeah, it's been very hard on everybody.
I'm so sorry, Jessica, but your strength came to the surface and it manifested itself in the most remarkable ways, which we're going to get to in just a bit. So my next question, Jessica, is really a 2-part question. You've managed to access several therapies for the management of your stage 4 disease. Some of these were actually out of province here in Ontario. I'm certain viewers are interested in knowing how you managed to achieve that. That's the first part. And as a young mother and wife with a lovely young family and a career, can you share with us if there have been any unmet needs along the way that could be or could have been improved upon?
Yes, there was many. I'll start off with when I was diagnosed, my oncologist only gave me chemo options, and I was able to connect with CRAN, and that is where I was educated about other options available for me. And then I had to be the leader in my care, and I had to put those referrals in. I had to follow up. I had to connect. I've been able to connect my surgeon and my radiologist together. So I've had to do it all myself, and that is overwhelming. And that's where that unmet need is if there is a trial going on in another province, because I was part of a clinical trial over there that is accepting patients all over the country. Why wasn't I told about that? And it would have been a major support for me if I had someone to help navigate the system for me. And then the major thing for me is I had a 3-year-old at that time, and I went over 3 times and 10-day times. I had to find my own accommodation. They do have a lodge, but it was under construction. I had to pay for my flights, pay for my food, and it was very hard not to have my daughter there. And childcare is a huge barrier. Like it's very, very hard to navigate this with a young child. And then my husband had to take time off work, and he actually wasn't paid for one of the times. And then he was worried he was going to lose his job. But he was there to be my caregiver, and I needed him. So there's probably a few more there, but I'll let you continue.
So, and can you tell me, did you find that communication was one of those unmet needs that could have been improved upon?
Yes. Thankfully I was good at navigating the system, but it took some time to learn. Yes, I had to commit. Yeah, there was many times that it was me, and they were curious why the oncologist wasn't following up too. And I said that he has no time for this kind of stuff, I was told. Um, yes, it was. I've been told I've helped other people do the exact same thing, and most people are really overwhelmed. They don't know because half the time referrals don't go in. You have to follow up. You have to, coordinate different doctors, and that's what I was just doing before. I had something and I had to coordinate a few things, and that's not my job. But for me to get these appointments and to get treatments, that's what I have to do.
Okay. It sounds as though patients really do need to assume an advocacy role in order to assist with their own care. Here's my third question to you, Jessica, and that is if you could provide advice to any newly diagnosed cancer patient, what would that advice be?
Yeah, in the beginning, it's overwhelming. And I just trusted that the team would have all my information, tell me exactly what was going on. And I found that that did not happen. They told me very little. So I wanted to know exactly what was happening with my cancer and to be organized. So I think in the beginning, just getting all the paperwork, putting it in a binder, being organized, knowing what mutations you have or what tests are coming up, what treatment options. It just slowly piecing it together so that when things come up, you know exactly where to find them. Another thing is I had a lot of friends and family do some unexpected things. They were not as supportive as I actually thought they would be. So in the beginning, it's very overwhelming. There's a lot of people coming to support you, and then eventually people will phase off. And so don't be surprised if you have some challenges, because cancer, and especially with an incurable diagnosis, people do not know how to act. And so I really had to take care of my mental health through it all. And my husband was able to, we became stronger together, and that's not always the case. But we really had to work at that. And so for I think the biggest thing is actually getting connected to an advocacy group. So whatever cancer you have, I always tell people find that advocacy group and join them, connect with other patients, see what everyone's doing. And so that's what I did, and thankfully it was right away with CRAN. So yes,
All
there
right.
you go.
Thank you so much for joining us today, Jessica. I'm so grateful to you. Uh, I I know I speak for all when I say we wish you continued success and the absolute eradication of those 2 remaining tumors. We wish you Godspeed, Jessica. Godspeed.
Thank you so much.
You're very welcome, dear. Ladies and gentlemen, we have a wonderful lineup of expert speakers for you today, addressing riveting content from catching cancer early to improving access to advanced diagnostics, such as comprehensive genomic profiling, to our session on advancements in the management of lung cancer and breakthroughs in immunotherapy. These are just a few of the sessions we have lined up for you today, my friends. So sit back, enjoy, and engage as together we strive to improve care for early age onset cancer patients in Canada. Thank you, and back to you, Cassandra.
Thank you so much, Philomena, and thank you, Jessica. Jessica, I think you know how much I admire your strength and resilience, and thank you for being with us and sharing your experience today. Philomena, thank you for that lovely introduction, and welcome to kick off the day.